You can do this one either sitting on the side of the bed, or you can do it in the bed. And some of you that have heard me run my mouth before, you know that my preference for you is to teach them to do it in the bed. Because a lot of your people are large. They're large and out of shape. And they can't get down here and squat and maintain that comfortably long enough to do a good job. I've seen it every weekend. There'll be somebody that's bigger than I trying to squat down and do foot care, and it's all they can do to breathe, much less concentrate on what they're doing.
Can you provide them with a stool to sit on? Can the person doing the foot care sit on a stool?
Yeah, there's one there.
They can't. I have a little short stool, I'll let them sit on.
Yeah, and that's fine. If you got them, if they can do that, that's fine. But there's, to me, it makes it faster and easier to handle. But how y'all decide to do it is totally up to you. It's just a thought that that you do see people that are really struggling because their body is in a strained kind of position. All right, Miss Press, we're gonna wash this foot. Need to put a little foot care on this side over here. I think you stepped in some chocolate with this one or something. Okay, so let me go get my stuff. I'll be back with you. I have a couple of towels here. I'll just keep those. And reuse these. Oh yeah, thank you. I was looking for gold. I was looking for that color right there. Oh wait, let me get the woods. It's not ready. Let me get the woods while that thing is ready. And we got lotion. And we got soap. And I'm putting my gloves up here, and y'all know why I'm doing that. And we're going to get some water. Should have let it run during lunch. You may have to do a little bit, girl. That's alright. Alright. It's getting it's not freezing now, so yeah, not great, but we're gonna roll with it. Alright, so I'm checking the temperature, but what's the other half of that sentence? They have to verify. And if one does and one doesn't, they get credit from neither. Check it out, girl. See what the temperature is. Wonderful. Is that all right?
That's good.
Wonderful. Okay. Okay. Here again, be sure they dry their hands on a paper towel or something. They can pull a couple of paper towels before they get back over here. I did it, so I'm going to use that. What's the story on gloves? What's the glove story?
Put them on before washing gloves.
And if they don't put them on,
They'll stop.
they'll stop them. And do they get credit?
No.
Nope. That's not one. That's not a mistake you can correct. Once you made that one, you've made it. Okay. Alrighty now. Okay. So we're just gonna slide this sock right off. I'll put it right there. Expose that pretty leg right there. Did you get a good shot of that leg? We got to have a barrier underneath our basin, so regardless of whether you put it on the floor or whether you put it here, it needs to have a barrier under it. Okay. Alright now. I'm going to want you to bend your knee. Can you bend your knee for me like you're doing range of motion, kind of, sort of? Alright. And Rich is propping that foot up there to create the awareness that that knee will bend, so they don't try to bend here and break their leg. Now, here is a math application. If I was in the classroom, I would do that this year. I would have, before this exercise, I would have them measure this pen across here. I would have them measure this pen this way. And then I would have them measure this pen diagonally. Now, it sounds elementary, but I have seen so many people try to ram a big foot into this bucket, and the toes are pure sticking up, just like that right there. And it makes you want to cry. You know, it makes you want to cry. So, it's not that our kids aren't smart, they are, but they have no common sense. And so, turn it into a math exercise before you do this skill. Okay, this measurement is this measurement is this measurement is this. Which is the longest measure? Obviously, diagonal is going to be the longest measure. So, with that said, we realize that the knee will bend. We're going, Miss Beth, I'm going to put your foot in this water right here, okay?
Okay.
Alrighty now. Woo, that's kind of chilly, ain't it? Alright, now, her knee is bent. I've given her all the advantage I can, and she's got a short little foot, so she's still got 2 inches left. Don't put too much water in that basin. As long as the bottom of the foot is covered, it doesn't have to be all the way up to the ankle. In the back, it looks like maybe it's 2 inches. In the front, her toes are barely covered. So don't get so much water that you have a mess when you get to this point. Alright. Now, where's the soap going?
On the rag.
On the wash rag. Why is it going there? Anybody? To keep it out of the water. Right, keep it out of the water. I need some more water. I'm going to bring the water to the rag, not the rag down there. Okay. Now, the steps say that I am going to lift the foot out of the water, support, and I'm going to wash. Now, I'm going to ask her to lay her leg down, and that will help me support there. But I've lifted it up like it said.
Brittany Gonzalez, Alexis Steele, Savannah Baldwin, Gabrielle Rice, and Desiree Moore. Discount office.
I'm supporting her foot. Her leg's kind of supported with the bed here. And I'm supposed to get these little toes. This little piggy went to the market. This little piggy.
Also, soccer players, you need to be on the bus by 3:20 this afternoon.
Okay, I've got her washed up good here. Now, to keep from getting excess soap in there, this is a second rag. I'm just going to get it wet. And I'm going to rinse, much like I did her arm earlier. I don't have to do this, but just to make me feel good and feel like I really rinsed her well, I'm putting her back in this water. Is there any soap in this water?
No.
Nope. And there's not really any soap on her foot because I already wiped it off. Okay. I'm going to set this over here. And I'm going to dry her foot. I don't know why I got that towel, because I really don't need but one here.
Rachel Tickle and Brittany Rowland come to the front office.
And I need to dry between these toes. How we doing, Betho?
Doing okay.
I guess you are.
Sydney Wise, Taylor Banner, Timothy Sample, Savannah Baldwin, Alexis Steele, Gabrielle Rice, and Desiree Moore to the counseling office.
I know y'all don't believe what I'm fixing to say, but I actually missed that. The only thing we hear is fire drill. Okay, you can anticipate a problem right here. You've taught your students to be so sensitive to their patients that they're going to ask them everything. Do you want cream? Do you want this? Do you want that? Do you want the other? When they go for testing, get them out of that mood. We're putting cream on your foot. Better. Beth, you gonna leave me there?
Lord have mercy.
Alright, I can do this right here all day. I love doing this. Okay. Alright, but we got our foot greased up there. I got a little in between your toes, and I shouldn't have done that, Miss Evaluator. I was getting carried away. I was fixing to do a massage. So I'm going to get that out, because I know you're not supposed to have no lotion up in them toes. And in the event there's a little excess, I'm going to blot that off. Oops, let me get you. Okay. Supporting the leg and the foot. Putting it back down there. Alright, Miss Lady. Get you covered up here. Alright, where's your call bell, dear? Here we go. There's your call bell. Put this here. I didn't really use that. I'll put that up in there. I did use this, so I'm gonna come over here and I'm gonna empty, rinse, and dry. Oops, excuse me. Does it say you have to wipe that table off? Does it? No. No. That's one of the things as an evaluator I constantly do when I keep a wash rag in my pocket and I'm wiping that table off after every skill. In a real world, is it expected? Sure. But for testing, just roll on. Just keep it rolling. Everything's put up. I'm going to take my gloves off. And I wash my hands. She's got her call bell. I think everything's put up, and I'm done with that skill. I think I'm done. How'd I do? Anything in there?
So, would it be best for the kids, just because of the testing and the time, to not just have them leave the bed at that low position all the time and never raise it for their working height? Or
You know, if you got a kid that's truly got a back condition, then they need to take advantage of that. But most of them are going to be able to hang with 30 minutes. And that's where you're helping them understand the perspective and the difference in what they're doing. If they're on a real floor and they got 20 patients to take care of, they better do exactly what you said, or they'll never get it done. Their back will be killing them. For testing purposes, if you don't put it up, you ain't got to put it down. So, you know, and I've said it over and over, but it's the truth of the matter. Once you're comfortable with these two different perspectives, they will be comfortable. Once you make it okay that you can coexist in these two worlds, and one is not an insufficiency of the other. I may have told y'all about the time that I went to a school and I walked in and the teacher had this book right here. And she was waving it in the air. Did I tell y'all about that? I did an audit and I got there just a little bit early and she was waving it in the air and it was blue at that time. She said, "Y'all see this book right here? I don't know who wrote this book, but they don't know what they're doing. This is not the way you take care of patients." I'm about to grab my pants. So at the break, you know, it was first block break, second block. So I went to the teacher and I said, "Well, if it's okay with you, I can give you a break second block. And I really miss the classroom. Can I teach your block second block?" She said, "Oh, sure, yeah." I said, "Okay." So they went to the bathroom, they came back, and I picked up the book and I said, "Y'all, I'm going to tell you something. Your teacher was right on point. She told you the honest to God truth. This book right here is not written in such a way that you can take care of patients well with this." She was right. This book is a test. The way you're really supposed to take care of patients is the way it is in your skill books, and they have their skill books on the table. I said, "That's the way you take care of patients. This is the way you pass that test. This don't fight with that. This is a different perspective of that. This is modified for testing purpose. That is established for good patient care." And you could see the light bulb, bing, 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 and then they were fine with it. And best of all, her light bulb came on. You know, but when you stand up in front of a class and you discredit this test in front of your kids, you might as well go right on and just say they're going to fail. and you can tell them that there's a lot of research, even though we don't agree with all of it. There's a lot of subject matter expert in this. The National Council of State Boards of Nursing. They have representation from every state in the nation. They sit around a big table. It's Chicago, Illinois. I've been up there one time and represented North Carolina. And I'd like to do it again, but just can't go everywhere. But y'all can go. But there's people up there, and they debate amongst themselves. They come to a consensus amongst themselves what the knowledge should be, what the skills should be, and what the minimal standard is. So even though we may or may not agree with a certain step, it has been thought over. It has been pondered extensively by subject matter expert. And it explains all this in the front of the book. And that in itself can be a lesson, you know, about subject matter experts and how when you're in your field, whatever field you're in, you may be called on to be a subject matter expert. Amy, if there was a court case today on pediatric care in a hospital, she could be called on to be a subject matter expert because her clinician experience was pediatrics. And so they need to understand, and as teachers we need to understand that these are just not just kind of happenstance, that they are the way they are for a reason. Let me back up to blood pressure. I meant to say something about that I didn't say. So flip back to blood pressure in your book. Notice that it says 160 to 180. If they pump it up to 160 to 180 and they hear it just as soon as they open that valve, they may pump it up to 200. But tell them do not pump it up over 200. If they pump it up to 200 and they still hear it, then they're going to have to stop, you know, the evaluator's going to stop the timer and make some adjustments there, because they will do an emergency stop if they pump it up to 200, above 200. And for these people that are just very carelessly, you know, you've seen them, they just go till they can't go anymore, and wherever it happens to be, that's where it is. They cannot pump it up above 200. And we understand the clinical reasons for that. Yeah, a nurse may do it above 200 with knowledge of what may happen, but a nurse aide, that would not be in their realm of expertise. Does that make sense? So watch out for that landmine. That's different from last year. Emergency stop if they get to 200. All right, what's the next skill?